Sandy, we're talking about lumps and bumps and how we can detect them as doing self-breast exams and also getting a mammogram at a certain age. Tell me a little bit about how we can do self-breast exams and how we cannot freak out if we find a lump.
Well, you definitely want to be familiar with your breasts. Doing a self-breast exam once a month is probably your best way. A lot of people feel like they have so many lumps, they're not really sure where to even start or what's to worry or what not to worry about. Really what you want to make sure is that you're doing it once a month so that if there is something new, you'll familiarize yourself with it. If you do that, then the lumps and bumps won't be scary to you. 80% of lumps that come into our department that we do exams on are benign, which is just, they're not cancerous or anything. So that's 80%. The other 20% are though. So even though some people want to just give up on self-breast exams, do your monthly exam. It definitely helps familiarize yourself with your breasts. Therefore, if there is something new, we can take care of it. Not a problem.
The C word is a very scary word for some of us out there, thinking, okay, if I have a lump, I'm going to go find out it's cancer. Right. And then, my life is going to change dramatically. But how important to come in if you have something? What is something that you need to kind of look for in that kind of site?
You definitely want to look for the lumps and bumps. You want to look for any skin thickening, redness, rash. Sometimes your nipple can invert a little bit or dimpling on the skin. Make sure it's not just a feeling, but you also want to look and make sure things are staying normal. I've had even family members who have had a lump and were so scared that it would be something that they didn't want to come in, and they waited months and months and they came in and it was fine. So don't be scared. If anything, coming in and taking a look at it will take your worries away, and 80% are fine, but it's those 20% we want to catch early.
Exactly. Tell me a little bit about your equipment that you use here to detect those kind of lumps and bumps.
Well, here at Logan Regional Hospital and in our mammography department, we have the digital mammography. We recently switched to that back in 2007. This is definitely a little more sensitive than the film, and we can see more. It's higher resolution. It helps us to catch the cancers early, and a lot of times you won't feel a lump or a bump or have any of those symptoms, and because of the digital mammography, we can catch it early before you even know there's a problem, and therefore it won't even bother you. We take care of it and no more worries.
And what is a good age to come in and get your first mammography, or your first mammogram, I should say?
This has been a hot topic ever since the federal task force came out with their regulations and the recommendations back in November of 2009. They recommended that women come in at 50 years of age and come in every other year. Our imaging director of breast care services here at Intermountain Healthcare, Dr. Brett Parkinson, he and his team of experts, along with experts across the country, still have done a lot of research that still agrees with the American Cancer Society's guidelines on you need to get a mammogram every year beginning at the age of 40. No excuses, no.
And what
changes.
if you have a family history maybe?
A family history, you definitely want to mention that to your doctor and also to the technologist that's doing your exam. We keep a close eye on you if you have a family history, but a lot of times people say they don't feel like they need to come in because they do not have that family history, but 80% of the breast cancers that we find in women are on women that do not have any family history. So even though you don't have a family history, you need to make sure you come in every year starting at the age of 40. Between the ages of 40 and 50, it's younger, but we do find 20% of our breast cancers in that age range, and the younger you are that you get breast cancer, the more aggressive the cancer is. So you don't want to
early detection if you're younger.
It's key. Yeah, you want to make sure.
If you're younger than 40 and you find a lump, it's better to get in there and get it early.
Even if you're younger than 40, if you feel like you're having any symptoms, talk to your doctor. They'll help you schedule a mammogram here at Logan Regional. We can take your mammogram, make sure it's nothing, and then the next time they'll have a comparison for you.
Definitely sleep better.
You'll sleep better, you'll have better weekends, and we'll take care of it. And if we catch it early, it's not a problem.
I had a close friend that had her father die of breast cancer. So what do men do too? I mean, we don't talk about that very much, but that is they have breasts too.
It's true. Yeah, and they don't come in very often, and men only account for 1% of our breast cancers that we find in everybody, but they still need to make sure that they're keeping an eye on their bodies as well. If they feel like they have a lump or a bump or redness or anything, come in, get a mammogram. It's not the first time. It's not uncommon.
Very common then. Well, I appreciate you, Mandy. Definitely to get in and we're all about getting screened right now, and get in and get screened for breast cancer if you feel like that's something you need to do. If you're over 40, definitely get in right away.
Yep.
Thank you so much.
Absolutely. No problem.